and welcome to NHIS in a Week. This is where we give you happenings and updates within the authority and the scheme. My name is Ifia Trema. Now, the headlines. Dr. Mrs. Yapoke champions women's health financing. Black Stars commend NHIA and NHIS free dialysis intervention. USAID sponsors training program for 300 NHIA staff. Now the news in details. Ghana's senior male national team, the Black Stars of Ghana, led by Captain Thomas Partey, has paid a courtesy call to the Chief Executive of the National Health Insurance Authority, Dr. Dacosta Abuaje, and his management staff.
You know, the authority is the main funding arm for our healthcare in Ghana, and there are a lot of pressing needs in terms of the disease burden. And we believe, I've had meetings with KETS and other management members, and we believe that we can use sports in promoting healthy lifestyles. So it is not coincident that obviously you are here today, because we really want you to help us in promoting the good health of Ghanaians.
They congratulated the COVID-19 coordinator, Dr. Dacosta Abuaje, on his recent appointment as CEO of the NHIA, and further went on to commend the government and the NHIA for the timely intervention in funding dialysis treatment under the NHIS. The players pledged to support Dr. Dacosta Abuaje and his team to succeed, especially in leveraging sports and physical activities to promote healthy lives.
On behalf of the players, we want to say thank you for inviting us here. We are here to support you, and I think anything that we have to do to support the health scheme for the Ghana, we are here to do it.
The Deputy Chief Executive in charge of Administration and Human Resource at the National Health Insurance Authority, Dr. Yapoke Mrs., has emphasized the need for adequate health financing to improve women's health care, especially in the African continent. She was addressing the second African Women's Health Symposium in Accra under the theme, A New Dawn of Partnership for Women's Health.
To our fellow healthcare institutions, let us share best practices and jointly develop comprehensive strategies for women's health access. Again, to the research and development community, let us work together to accelerate innovative solutions for women's specific healthcare needs. And to the private sector and NGOs, who I see a lot here today, let us leverage our collective resources to ensure affordability and equitable distribution of essential medicines, not forgetting that we need to invest in healthcare infrastructure.
Dr. Yapoke Mrs. bemoaned the millions of women and children lacking access to life-saving medication, leaving them vulnerable to the scourge of preventable diseases and untimely death.
Breast and cervical cancers disproportionately affect women in Ghana, yet access to timely diagnosis and treatment has historically been limited, particularly for those from low-income households and rural communities. For countless women diagnosed with these devastating diseases, access to life-saving treatments such as chemotherapy and cervical interventions is no longer a distant dream, but a tangible reality, thanks to the National Health Insurance Scheme.
About 300 members of staff from the National Health Insurance Authority has participated in a USAID-sponsored Trainer of Trainees program to enhance skills in customer service, communication, and relationship building.
We want to hit UHC by 2030. What is the membership? Membership is lower than what we are expecting now. We want to reach 80%. But it takes you, it takes me. It doesn't take only people in headquarters, but everybody has a role to play. But you have to be able to work such that you genuinely care about each one of you. You respect your differences. You also make sure that you get feedback.
All of us are a role to play. All of us. It's not just PROs, it's not just corporate affairs, but each and every one of us can be ambassadors to speak to one or two or three people around us and in the communities to try and make sure that we are pushing such a.
I'm just pleading with you, whatever you are being taught here, please take it seriously. We want to make sure that we still maintain our members for them to continue to request the services that we are providing.
The training, held in Accra and organized by the Corporate Affairs and Training Directorate Unit of the NHIA, involved regional and district staff from various regions. The program is aimed to improve performance and align with the NHIA's goals of promotive and preventive healthcare. The participants expressed gratitude for the training and committed to applying their new knowledge in their roles.
I have learned a lot. As a district, we want to try as much as possible to do writing more of these, shall I say, reports or articles on research.
I would say that today's meeting is very, very fruitful. It is good we having this training, and I think training is the way forward for us to be able to change our attitude, because we are going back to impact this on students. Personally, I have also learned a lot, and I promise that we are going to leave that paper, and we will all work together for the good of the.
For me, the things I've learned here we use so many diverse ways. But clearly, as our group, Madam has said, we have listened, we have got water for the person, we have apologized, we have ensured that we have worked on the challenge, we have given good feedback. And that person who came back to thank us. Also, she forgot to add that she got members already.
The Chief Executive of the National Health Insurance Authority, Dr. Da Costa Abuaje, has been sworn onto the National Identification Authority, NIA, as a new board member to bring his expertise and knowledge to bear in his new role. Dr. Abuaje, who was sworn in by the Minister of Interior, Honorable Henry Korte MP, charged to bring on board his wealth of experience in supporting the efforts of NIA to enhance the country's security and development. Mr. Osod Mensah represented the NHIA as Dr. Abuaje took the oath of office and oath of secrecy, pledging to uphold the Constitution and fulfill his duties with integrity and diligence.
Holding of office of member of the board of the NIA.
Do, in the name of the Almighty God, swear.
Do, in the name of the Almighty God, swear.
Solemnly affirm.
Solemnly affirm.
That I will not.
That I will not.
Directly or indirectly.
Directly or indirectly.
Communicate or reveal.
Communicate or reveal.
To any person.
To any person.
And defend the Constitution of the Republic of Ghana.
And defend the Constitution of the Republic of Ghana.
As by law.
As by law. Established.
So help me God.
So help me God.
The event was attended by the Deputy Minister, Honorable Nana Eya MP, the Board Chairman of NIA, Mr. Abel Edusei, Professor Kenneth A. Atefua, Executive Director of the NIA, and officials from the Ministry of Interior, the NIA, and NHIA, all gathered to witness this important moment. The National Health Insurance Authority recently welcomed a delegation from the Nigerian Pharmacy Council seeking to learn from the NHIA's successful integration with the National Electronic Pharmacy Platform, NIP. Led by NHIA Deputy Chief Executive Louisa Atta Ajiman, the meeting highlighted the importance of collaboration between the two institutions and emphasized the need for sufficient funding to sustain Ghana's national health insurance scheme. A presentation by Mr. Ebenezer Hooper from the NHIA's Management Information System Directorate showcased the NHIA's integration with NIP, outlining project details, challenges, and recommendations. The National Health Insurance Authority and the National Identification Authority have signed a cooperative agreement to register 6.3 million children aged 6 to 14 for Ghana cards starting June 10, 2024. This initiative aims to provide these children with healthcare access through the National Health Insurance Scheme and official identification via the NIA.
Let's go all out. Let's get these young ones registered. Let's make sure we do the right thing. Let's serve our people. Let's serve Mother Ghana. Together, I believe we will achieve this ultimate goal to reach the universal healthcare coverage by allowing every resident in the country with a Ghana card who is currently not enrolled on the NHIS to enroll at their own convenience, and I mean in the comfort of their homes, and do not need to go to the NHIS district offices to do their own enrollment.
The collaboration highlights the Ghanaian government's efforts to streamline administrative processes and enhance social services. The initiative is expected to improve access to essential healthcare services and facilitate participation in socio-economic activities requiring official identification, thereby promoting a more inclusive and empowered society.
Hey, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for internet. But no shaking. I have NHIS already.
After you're on a line, ting.
Ina, look at you. What are you going to do in the office when you can just download the app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Please, Seth, I'm starting work next month.
This is how we end this week's edition of NHIS in a week. Kindly log on to our website at www.nhis.gov.gh to get more information. Also, kindly subscribe to our social media channels displayed on the screen. Thanks for watching.